Section 1C, Circulatory and Respiratory Systems. The circulatory and respiratory systems work together to provide our body with oxygen. This oxygen is used in the energy making process. The circulatory system is made up of the heart and the blood vessels that carry blood around the body. The blood carries nutrients to our organs, tissues and muscles and takes away waste products. One of the most important nutrients for physical exercise that it carries is oxygen. Our muscles need this oxygen to work, so the efficiency of the circulatory system is a vital factor affecting performance. The main function of the respiratory system is to get oxygen out of the atmosphere and get it into our bodies. It also gets rid of carbon dioxide and other waste gases that we cannot use. Once we breathe in air, our body separates and diffuses the oxygen into the bloodstream. It gets rid of some gases that we don't need, but the oxygen in the bloodstream is then transferred back to the heart from the lungs and is then pumped around the body to be used at the muscle sites to create energy. When the oxygen has been used, the blood has carbon dioxide in it. It travels back to the lungs and is breathed out. This process of gaseous exchange takes place in the alveoli, or the little air sacs in the lungs. It is very important for your studies to be able to understand how the circulatory and respiratory systems affect your performance. If both systems are very efficient, you can consistently provide the muscles with the oxygen they need. As a result, you don't produce lactic acid. As a result of that, you won't get cramp and will be able to work harder and for longer. Your recovery rate after exercise will also increase, as you won't have so much oxygen debt where you haven't been able to get the oxygen to the muscles quickly enough during the physical activity. We all know that physical exercise makes us fitter, but what do we mean by fitter? Well, for starters, the effect of exercise on your circulatory and respiratory systems is massive. For the circulatory system, exercise makes sure we have stronger heart muscle. We have increased stroke volume. This is the amount of blood that the heart can pump out in one beat. We also have an increased cardiac output. This is the amount of blood that the heart can pump out in 1 minute. And to work it out, you can multiply your heart rate by your stroke volume. We also have a lower resting heart rate if we exercise over time. This is our heart rate when we're doing nothing. For most of you, it's somewhere between 50 if you're pretty fit and 90 if you're not so fit. Benefits of exercise for the respiratory system include having more efficient gaseous exchange. This basically means that our lungs become better at getting rid of carbon dioxide and better at taking as much oxygen out of the atmosphere as possible. We also gain an increased vital capacity, which is simply the total volume of air you can move in and out of the lungs in one deep breath. This is important for a sportsman in that if we can take in more air and therefore more oxygen in one breath, we can take in more during the activity. Through exercise, we also increase our tidal volume, which is the amount of air entering and leaving your system with each breath. The quicker we can remove carbon dioxide, the quicker the blood can take up fresh oxygen again. Our tidal volume is our normal breathing rate. These benefits mean we have greater oxygen debt tolerance. Oxygen debt tolerance means that when we can't get oxygen to the muscles quickly enough, our bodies can deal with it that little bit better. This allows our bodies to maintain its performance for a bit longer. which is vital in physical performance sports. Our blood also has a vital role to play. Blood is made up of 4 main components. Red blood cells are the first. These carry oxygen and are absolutely vital in physical activity. White blood cells do a slightly different job. White blood cells attack and destroy any viruses in our body. They're there to protect us. Platelets do another job as well. Their job is to patch up or scab cuts and grazes to allow our skin to heal quickly. Plasma is a watery substance that carries many of the nutrients that our body needs. These are the 4 main components of blood. You need to be able to explain the difference between aerobic and anaerobic work. Good examples of aerobic activities are ones where the intensity of the exercise is quite low and the duration is quite high. So long distance jogging or an hour aerobic session are great examples. Anaerobic work, where there's no oxygen involved, are quite short activities and the intensity of the work is very high. So a 100-meter sprint race is a very anaerobic activity. Aerobic means that there's oxygen involved, and anaerobic means without oxygen. When a performer works anaerobically over a long period of time, lactic acid is produced. Lactic acid almost acts like a poison that sits in the muscle belly and stops the muscle working very well. Eventually this causes cramp and the muscle seizes up. The best way to get rid of this is through aerobic light activity, such as jogging around. Some players may stretch the muscles to try and release some of this lactic acid. You'll see this on football pitches when the physio comes on and grabs hold of the player's foot to stretch out the calf muscle.